So this is the extra credit cranial nerves assignment, um, where I will show my understanding of the cranial nerves. The first cranial nerve number one, is the olfactory nerve. It is a sensory nerve. Its function is for olfaction. Which is essentially smell, and then you just test for it by testing for a person's ability to smell. The second cranial nerve is the optic nerve. It's also a sensory, and its function is for vision, and you test for it by testing for visual fields and visual activity. Cranial nerve number one and cranial nerve number two are located in the cerebrum right here. And then the third cranial nerve is the ocular motor nerve. It's responsible for four of the six extraocular muscles in the eye. It has smooth parasympathetic fibers that connect to the smooth muscle, which allow for people um, people controlling the pupil size. And it's also a motor nerve. And then the fourth nerve is right here. It's the trochlear nerve. It's also a motor nerve, and it is responsible for one of the six extraocular muscles in the eye. And then you just test for it by testing for eye movement. Um, and also you test for um, cranial nerve number three by testing for checking for eye movement and pupil constriction. I'm not sure if I said that right. And then these cranial nerve number three and cranial nerve number four are located in the midbrain. Cranial number five, six, seven, and eight are located in the pons. And then cranial number five is this one right here. It's the trigeminal nerve. It's both sensory and motor. The sensory refers to the mouth, the nasal cavity, and the face. And then the motor is muscles by mastication by V3. Mastication is chewing. And then there's three divisions in the um, trigeminal nerve: B1, B2, and B3. B1 refers to the ophthalmic, B2 refers to the maxillary, and B3 refers to mandibular. And then you just test for sensory by putting both your hands on a person's face to see if sensation is intact and equal bilaterally. And then you test for the motor function by asking a person to clench their teeth. Cranial number six is the abducens nerve. It's a motor nerve. Its function is one of the six extraocular muscles in the eye, and you just test for eye movement. The seventh nerve is the facial nerve. It is both a sensory and a motor nerve. The sensory function of the facial nerve is taste from the anterior two-thirds of the tongue, and then the motor function of the nerve is muscles by facial expressions um, through the salivary glands, like the sublingual glands, the submandibular glands, and also the lacrimal glands, lacrimal glands. And then you just test for the sensory function by just testing for taste on that anterior two-thirds of the tongue. And then you just test for the motor function by asking the person to smile, frown, their eyebrows, clench their teeth, or just show their teeth and puff out their cheeks. And then the eighth nerve is the vestibulocochlear nerve. The eighth cranial nerve is the vestibulocochlear nerve. It's a sensory nerve, and it is function is for hearing and balance in the equilibrium of our body. And you just test for it by testing a person's hearing and balance. And then the ninth, 10th, um, 11th, and 12th nerves are all located in the pons, in the medulla. Um, the ninth nerve is the glossopharyngeal nerve. It is sensory and a motor nerve. The sensory it has a special sensory and then somatic sensory. The special sensory refers to the taste on that posterior one-third of the tongue. And then the somatic sensory refers to the upper walls of the pharynx, which is the motor limb of our gag reflex. And then the motor function of the of this glossopharyngeal nerve is just refers to the pharyngeal muscles and the parotid gland. And then you just test for it by checking for that taste on that third of the tongue posteriorly, and then you just test for gag reflex. The 10th nerve is the vagus nerve. It is both a sensory and a motor nerve. The vagus nerve's sensory function is sensation from the larynx, pharynx, and visceral organs of the to the thorax to the abdomen. And then the motor function is the parasympathetic fibers um, that the parasympathetic fibers to the larynx, pharynx, and visceral organs to the thorax and the abdomen. And then you can't really test for, oh, wait, so that's essentially the motor. The motor function is also just the motor limb of the gag reflex. And then you can't really test for sensory here. So the main test is just the gag reflex for the motor function. The 11th nerve is the abducens. No, I'm sorry. The 11th nerve is the accessory nerve, and it is a motor nerve, and its functions are just the ability to like turn and shrug our shoulder and our head and just other related structures. So the two primary muscles in this nerve refer to the trapezius muscle and the sternocleidoid muscle. The way that you would test for the sternocleidoid muscle would just to be to turn your head against resistance, and then the trapezius muscle would be to shrug your shoulders against resistance. And then the last nerve, cranial nerve number 12, is the hypoglossal nerve, which is refers to the muscles of the tongue, the function, and then it's also a motor nerve. And you test for the hypoglossal just by having a person stick out their tongue and move it side to side. And lastly, I just want to reiterate my understanding. Cranial nerve number 1 is the olfactory nerve. Cranial nerve number 2 is the optic nerve. Cranial nerve number 3 is the ocular motor nerve. Cranial nerve number 4 is the trochlear nerve. Cranial nerve number 5 um, is the trigeminal nerve. Cranial number 6 is the abducens nerve. Cranial nerve number 7 is the facial nerve. Cranial nerve number 8 is the vestibulocochlear nerve. Cranial nerve number 9 is the glossopharyngeal nerve. Cranial nerve number 10 is the vagus nerve. Cranial nerve number 11 is the accessory nerve. And cranial nerve number 12 is the hypoglossal nerve. Thank you so much.